Greetings, everyone. I hope we find you all well today. My name is Amanda, and this is Nicole. We are here to discuss the topic of stroke. Some of you might have had a stroke before, or know someone who has. Strokes can be life-altering and scary, but with proper information, they can be overcome or prevented. We will be covering important information, including causes, preventions, identifying strokes, and caring for someone post-stroke. You might be wondering, what is a stroke? Strokes occur because blood stops flowing to your brain. And so your brain cannot get oxygen or nutrients. Brain cells die very fast, so emergency treatment is important during a stroke. These days, much less people die from strokes than they used to. How can you tell if someone is having a stroke? First, you might notice slurred speech. If you're having stuttering problems, this could be a sign of stroke. You might even have difficulty understanding others. Also, walking might become difficult. If you are feeling dizzy, stumbling, or cannot walk in a straight line, this could indicate stroke. Numbness of the face, legs, or arms, usually on one side only, is another symptom. If you feel weakness, numbness, or full paralysis, try lifting both arms, and if either one droops, or you cannot lift one fully, that could be a sign of stroke. Next, try to smile. If one side of your mouth droops, you might be having a stroke. If you are struggling to see in one or both eyes, this can be another indicator. Sudden blurriness or blacking out is cause for concern when experienced with these other symptoms. A sudden headache or migraine could likely come with a stroke. It could be painful enough to cause nausea and vomiting. If you experience these symptoms or see them in someone else, call 911 immediately or get the victim to the nearest hospital. Don't wait. It might be tempting to see if the symptoms fade, but the faster you react to them, the better off you'll be. Remember, fast. Facial drooping, arm weakness, slurred speech, time to call 911. Stroke symptoms can come and go during a stroke. And remember, brain cells die during the attack, so get to a medical professional fast. If you are with someone who is having a stroke, stay with them and watch them carefully until help has arrived.
What can happen when you have a stroke? Many complications can arise from having a stroke. It can cause permanent disabilities, which is why fast response is crucial. Paralysis from a limb or an entire side of the body can result from a stroke. You can also lose control of certain muscles in your body. You might experience long-term difficulty speaking and swallowing. The muscles in your mouth and your throat are usually at the highest risk of being affected by a stroke. Impeded speaking and understanding language can also result from a consequential brain damage. Memory loss, including difficulty creating new memories and forgetting old ones, can result from a long stroke. Emotions can also be affected by stroke. Anger and depression are common after stroke. This doesn't always last forever, but it can be difficult if someone hasn't experienced problems with emotional management before. Of course, pain and stroke are very common. Parts of the body might experience tingling or have sharp shooting sensation now and then. If you lose feeling in a limb and then recover it later, it can cause pain as well. Those who have had a stroke will likely need help with self-care. So understanding, compassion, and assistance with basic needs is important. We'll talk about all of that later on.
After all of this information, you may be wondering, what can be done? Let's talk about risk factors. Modifiable risk factors are those you can improve by changing your lifestyle. Being overweight, physically inactive, using drugs, or binge drinking are all factors that can contribute to stroke. Smoking cigarettes and even secondhand smoke can increase your risk. We'll discuss how to modify these later. Non-modifiable risk factors are those you cannot improve, but they are important for you to remember and your healthcare provider. High blood pressure, cholesterol, diabetes, and sleep apnea, and heart problems can all increase your risk of having a stroke. If you have a family history of stroke, you should let your doctor know. What we're just now learning too is that COVID-19 can increase the risk of having a stroke. People who have an increased risk for stroke are African Americans, people age 55 and older, men, or people on estrogen. Now let's get back to those modifiable risk factors. How can we change our lifestyle to prevent stroke? Very common preventative measures include quitting smoking, drinking less, and eating better. What can we eat? Well, here on our nutrition board, we have, instead of ice cream, eat yogurt. They both taste really good. Instead of donuts, eat fruit. There's a lot of sugar in fruit, but good sugar. Instead of steak, eat fish. Steak and other red meats can increase your bad cholesterol levels, but fish can help lower your bad cholesterol levels. Instead of potato chips, eat popcorn. Popcorn is a great healthy snack as long as it is not covered in butter and salt. Instead of soda, drink water. It's important for anyone any age to stay hydrated. Less cholesterol and fat in your diet will reduce buildup in your arteries. Eating fruits and vegetables, 5 servings per day, is a great way to improve your diet. Exercise and losing weight can help prevent stroke. Getting your blood pumping on a daily basis helps all sort of cardiovascular problems as well. Exercise can lower your blood pressure. And as we saw, that's one of our modifiable risk factors. Gradually work your way up to at least 30 minutes of exercise per day. Don't push too hard and you will start to feel better on a daily basis. Managing other healthcare problems is a surefire way to decrease your risk of developing more problems, like stroke. Keeping your blood sugar low? Keep your blood sugar in a healthy range. Control high blood pressure. Treat any sleep apnea problems you might have. Talk to your doctor about maintaining your health and follow up regularly. Make sure you are taking your medications properly and not mixing them with alcohol and drugs.
Another piece of important information you might like to have is the type of strokes. What kind of strokes you might having is important for information to have as far as your health care is concerned. There are 2 types of stroke. They are ischemic and hemorrhagic. And they are important for treating each important. While treating stroke, it is important to know which type of stroke you have had. The first type is called an ischemic stroke. According to the American Heart Association, an ischemic stroke occurs when a blood vessel to the brain is obstructed, like a blood clot. It accounts for about 87% of all strokes. This type of stroke needs blood thinners to break up the clot and return blood flow to the brain. Antiplatelets and anticoagulant drugs can help prevent these types of strokes and are usually given to someone who has already had a stroke to help prevent them from having another stroke. The other type of stroke is a hemorrhagic stroke. This is a type of bleed in your brain. According to the American Heart Association, this type of stroke is caused by bleeding in the brain. Therapeutic medications focus on reducing the blood pressure. You might be familiar with these types of drugs, which are called, such as Lipressor. And this accounts for about 13% of all strokes. Speak to your healthcare provider about any medication you are taking and follow their instructions. Remaining on a medication schedule is very important in the prevention phase.
Now let's say you know someone who has had a stroke. How would you care for them? What can you do to help them recover? Recovery will happen over time. The fastest recovery usually happens in the first 3 to 4 months after a stroke. But some survivors continue to recover well into the first and second year. Be sure to ask the doctor or nurse about the victim's medications. Know the side effects and what to watch out for. Make a list of medications and organize them to be sure the victim takes what is necessary at the right time.
Also, sometimes the victim's home might need to be modified to prevent falls and to ease movement between rooms and in using the bathroom. Be prepared to make these modifications prior to the victim coming home. A doctor and a nurse can give you suggestions on how to make these modifications at home.
Remember those modifiable risk factors? They show up again after stroke. Survivors of a stroke are at high risk of having another stroke. Make sure the victim eats a healthy diet, exercises, takes medications as prescribed, and visits their healthcare provider regularly.
After a stroke, physical therapy can help survivors as well. You should consider getting help from a physical therapist or from an occupational therapist to help victims with dizziness. They can help with frequent falls or difficulty walking and moving around. This includes needing to rest after small amounts of movement. Falls are common after having a stroke. Be sure to check for injury if a stroke victim has had a fall. This includes any bruising and bleeding. And if this happens, contact the healthcare provider and give them these signs.
Changes in emotions and attitudes are also common after a stroke. Depression can affect 30 to 50% of survivors. Encourage communication with the victim and consult your healthcare provider if emotions become too much for them. Depression support groups can also help managing depression or anxiety after a stroke. There are even support groups that focus on caregivers and victims post-stroke. Finally, don't forget to take care of yourself as well. Take a break from caregiving by asking a family member, friend, or neighbor to help while you take time for yourself. Eat healthy, exercise, and get adequate rest. You can't help someone if you are not cared for. Remember, on planes, we put our masks on before assisting someone else.
We hope this presentation has helped to inform you about all different types of strokes and all the aspects of strokes. We hope that this has helped you in caring for someone who has had a stroke and with help with the post-care of stroke. Please don't be afraid to ask your healthcare provider about strokes. They would be glad to answer questions and help you prevent a stroke. Have a great day, and thank you for your time.